Schizophrenia, a disease characterized by disturbance in emotion, thought, and attention. While not one specific symptom is needed for diagnosis, there are key symptoms, both positive and negative, that are used for diagnosis. And these include delusions, hallucinations, disorganized speech, catatonic behavior, flat affect, pleasure loss, alogia, and several others. Now, this disease occurs amongst people from all different backgrounds and walks of life.
Family studies show that schizophrenia is partly genetic. The risk of developing schizophrenia in an average person is 1%. There are environmental factors that increase the risk of schizophrenia. Many of those occur before birth. Prenatal risk factors are malnourishment, older age of father, and other pregnancy complications. A brain chemical that's called dopamine is thought to be a biological factor that increases the risk of schizophrenia.
There are currently many available treatment options for schizophrenia, all ranging with different levels of success. Using a combination of medications with social or educational support tends to have a 60% relapse rate, which overall is not very effective. Using a combination of medications with social skills training or family stress management has a lower relapse rate with 38% after 2 years, which is a better option. Drugs such as chlorpromazine, hyperbidol, and risperidol can help with symptoms of schizophrenia with a well-regimented medication. Schizophrenia is not an incredibly common disease, but it is a serious and chronic one. Worldwide, about 1% of the population is diagnosed, and approximately 1.2% of the American population is diagnosed. Schizophrenia symptoms such as hallucinations and delusions start between the ages of 16 and 30 years old. Schizophrenia typically starts in late adolescence and early adulthood. Males typically experience symptoms earlier than females. Schizophrenia occurs in all societies, regardless of class, ethnicity, religion, and gender.
We will be discussing three
misconceptions about people with schizophrenia. These are common issues or otherwise misconceived problems that people typically develop when thinking about the disorder itself or people with the disorder. The first one is that most people believe that people with schizophrenia are violent or dangerous. Now, this is entirely possible, but most people have other conditions that would cause such violence. These conditions can be other psychoses, such as bipolar 1 or 2 disorder, or other major depressive disorders, or other mental disorders in general. This could also be caused to substance abuse. Another misconception is that people with schizophrenia aren't smart. Though people with schizophrenia are psychologically troubled, this does not signify low intelligence. A major example of this is Nobel Prize winner in mathematics, Dr. John Nash, who was famously portrayed by Russell Crowe in A Beautiful Mind. Another misconception is that people belong in a mental hospital that are diagnosed with schizophrenia. Now, pre-1950s, or near the 1950s, where mental asylums and major mental institutions were in place, people with schizophrenia or other diagnosed disorders would typically end up there. But as of late, fewer and fewer people meet this requirement, just as research continues. People with schizophrenia tend to live in supportive community housing situations or with specific family, so as long as they're under the proper treatment and medication. The last misconception today is that people can't recover. 25% of people completely recover with schizophrenia. Another 50% show improvements in their symptoms, and many people eventually lead healthy and productive lives. A major way to help alleviate all these misconceptions and issues are if people happen to be educated about disease. As we discussed, we just shown numerous misconceptions that are highly common, but education, as proved in this PSA, is alleviating all these. We just discussed answers to all of these problems, and these rely on education for this disease to be better misunderstood. So people in general, overall, will have less misconceptions about schizophrenia, so eventually within all of the public, it can be destigmatized.